كن سعيدا كن فريدا عش بفخر في الحياة لا تبالي فالمعالي بالتحدي لا سواه كن سعيدا كن فريدا عش بفخر في الحياة لا تبالي فالمعالي بالتحدي لا سواه.
بسم الله الرحمن الرحيم. Assalamu alaikum wa rahmatullahi wa barakatuh. We welcome you again to our series of healthy lifestyles. Today we'll be briefly talking about what is mental health. In our previous series, we briefly discussed what is health in totality, and basically it had four main areas, and that was the social health, the mental health, the spiritual health, and the physical health. So today we'll be digging into what is mental health. And the WHO basically describes mental health as the subjective perception of one's health in terms of what he perceives in his abilities, in terms of his self-autonomy, in terms of his potential in intellectual health, in terms of his potential in emotional health, and the ability to be able to do his activities, day-to-day activities, coping with adverse stress. So basically, one who is mentally healthy is a person who actually can do his normal activities, undergoes his normal relationship, and basically he is a person that can adapt to normal change and can adapt to day-to-day stresses. So it is a very important aspect of mental health, especially that in our society, even in the medical field, most of the time you'll find that mental health is one of the areas that is not really given the urgency and the importance that it deserves. And it also comes with a lot of stigma. So when people talk about mental illness or mental disorder, you'll find that many people might either not come forward because they are sick. You'll even find that some of these people are actually hidden because of the stigma. They are not undertaken to go to their normal day-to-day lives. They are not taken to schools. They might not be interacting with others. So you'll find that this aspect of mental health actually, besides that it is not talked very much, people also have a lot of stigma, myths about it. And also you'll find that most of the time, most of the people, once they get late to actually identify this is a mental problem or this is a mental disorder. So today we would like to see what mental health, the importance of mental health is. When somebody is mentally ill, what are some of the causes that causes mental illness, and what should one do, and what are the few identifiers that somebody can know somebody is actually going towards getting mental illness or a mental disorder. I would like to point at this early stage that mental illness or disorders actually affect both adults and children. And in children, it can come even as change in behavior. A child might be behaving in a particular way, then he later changes that behavior. In some children, it comes as anxiety. A child might have been normal. A child is not crying. A child is going to school, is doing well. But when it becomes stressed, and then it leads to mental illness, you'll find that this child's mood changes. Might find that now the child actually becomes easily irritated. The child now can cry without much reason or with very little reason. Sometimes this child may not want to do the normal things. You'll find that he's becoming a bit reserved. The child was outgoing, used to go to play every day, but you find currently that this child just wants to sit by himself or by herself, is not doing the normal thing. So it will be important also to identify some of these in children. And the good thing about these disorders, mental disorders in children, most of them actually, when they're identified and treated early, they are managed better than in adulthood. So basically in adulthood, the mental illness that many people associate mental illness are issues like psychosis, where a person completely talks about the wrong things, goes mad, and can also be very violent. So these are some of the areas that many people know about mental illness. But there are other mental illness that actually they are not having this open or overt, outwardly characteristics or activities that this person possesses. For example, depression. A person can be depressed and actually can be very reserved. This person might have been a very good family member, might have been interacting well with his immediate family, was interacting quite well with the larger family, with the community, and find suddenly that this person is not enjoying any activity in life. He's not finding any happiness in the day-to-day activities. You find that he does not want to participate even with his normal job. He doesn't want to participate in the community activities around. He also does not want to actually be with the family. So you find that a person gets very reserved, gets somehow wants to be alone. These can be one of the mental illness. Mental illness actually affect all the other aspects of health. You find that if somebody is mentally ill or he has a mental disorder, he will not be able to maintain his physical health. He will not be able to maintain his or her social health. It will be very difficult to undergo the issues of his spiritual health. So it's a very important ingredient in health, and it is actually more important that people might know what are some of the causes that cause mental illness, and more so when they are identified, what are these things that we can do. And in most of the therapy of mental illness, where we'll talk about the treatment of mental illness, one of the most important things is that this person should be brought back to the family, should be integrated to the society. So the social support becomes very important in mental illness, because these enable the person to recover very fast. These enable the person to be able to start the normal activity that he was supposed to do. These enable the person to actually be integrated back into the society and be able to do what he or she was supposed to do. So what some of these things that when one is sick, one is mentally illness, that one can actually be able to identify. Some of the things in children, which I had earlier mentioned, is issues of the child being reserved, the child now being very hyperactive, the condition we call attention deficit hyperactivity disorder, where the child becomes very active, he's destructive. This activeness actually does not contribute to the normal growth, the normal development of this person and even those around, because, for example, if this child is in the class, he will want to disturb everyone. He'll be wants to move from one place to the other, even if they're supposed to be seated. So this hyperactivity also could be one of the signs that there's a mental disorder in a child. Autism, where a child actually now is not talking, is not hearing well. This is one of a condition that this child actually might be tending towards an mental disorder. In adults, most of the issues, the ones that we really know and people call him that is a mad person, is this outwardly aggressiveness. A person wants to hit others, wants to harm others. The other one, basically the major one, is a person who now becomes very reserved. Some of the causes of this mental illness actually are some of the things that we do day to day. Some substances have been associated with mental illness. We know things like cannabis sativa, that is bang, is been associated with psychosis. So most of the people who use this later end up having a mental illness. We know that in the long run, also use of substance like alcohol, a person like this might tend to have mood disorders, might tend to have mental disorders. So these are some of the substances that can also cause. We know that in some cases, when there are social things like death, grief, these are some things that actually sometimes can lead to people being very depressed, can lead to people having suicidal tendency. So these are also effects that can cause mental illness. We know if somebody cannot deal with distress, when now stress moves into a level that this person cannot manage, whether it is a family level, whether it is the workplace, or whether it is within the community. So we know issues, for example, during adolescent, there is a lot of peer pressure. This, if it goes excesses and it becomes a distress, it can lead to some mental disorder. We know also sometimes some drugs that actually affect the mental activity, the functioning, can alter the mental functioning and cause illness. So beside the alcohol and the bang that I mentioned, there are other medication or drugs that can be used and can affect. And most of these effects, when they are seen in a mental person, basically what they do, they alter the way the person thinks, it alters the way the person's mood, and it also changes the person's behavior. So these lead mainly to the thought process of the person. Now he cannot think as he used or she used to think. Then the mood of the person changes. Maybe this person was a quiet person, now he becomes very aggressive, or was a person who was outgoing, but now he's more reserved. Then the behavior of this person, maybe this person used to dress well, now he's not dressing well. This person used to be a social person, a person who used to interact with others, but now he's not interacting with the people the way he used to do. And also, it also manifests in the ability not to be able to undertake the person's activities, day-to-day activities. For example, this person used to work quite well, he used to go to work. Now he does not go to work, or even if he goes to work, he cannot actually perform that job or that function that this person was doing. So basically, these are the manifestation of a person who's really now mentally ill and cannot do his day-to-day activity. And these are very important signs for the people who are living together actually to identify, so that when they see that there's some alteration, one of the things, there's no external input, there's not something that really can be said that this is the one that caused these changes. So these are some of the signs that people should pick and be able to try to talk to the person. And if they cannot talk to the person, they should now look for the next stage for a professional support, so that actually this person can be talked to, can be counseled, they can look at the reasons, they can remove them. And if this is outwardly mental illness, there are several therapies that can be done, which we'll be mentioning later. Shukran. Okay, welcome back to our program today, where we are talking about mental health. And earlier we had mentioned what is perceived as mental health, some of the causes that actually lead to mental disorder or mental illness. And we are talking about what are some of these things that somebody can actually look out for, so that can identify that a person might potentially leading or is becoming a person who has a mental disorder or a mental illness. And the most important thing is that once these signs are seen, this person should actually get help. And we know that most of these illness, if they're caught early and they're managed well, most of them actually the person recovers well with the different medication that are there. And in terms of medication, basically, we have major three ways that mental illness or disorders are treated. One, we have the pharmacotherapy. This is the use of medication, actually, that now brings back the person to normal. Then we have what we call activity therapy. This is a person actually is engaged in either physical activities or occupational activity, so that he can get back to his normal self. Then we have what we call the therapies of bringing out what you have. This can either be through, could be through poetry, could be through acting, so that people are brought back to express themselves. So in terms of medication, basically, this is a person who will be seen by a medical expert, mostly the psychiatrists, the sociologists, the counselors, who will actually look into the history of this person. They like to know how this person was before, what are the possible causes, even during childhood, that might have led to this mental disorder, what are the current medical history, what is the medical current activities that this person has done or has been engaged in, or things that are possibly could be the cause, then they're treated. In terms of the activities, basically, this person is integrated back into what he used to do or what he can now do, so that he can be integrated very early enough back to normal life. And sometimes there could be a combination of the three, so that this person could be helped. As I'd said earlier, that one of the most important things with mental disorder, with mental illness, is that this person should be integrated back to the society, to the family. So the family support, the social support, the community support is very important, so that this person, one, feels that he's not neglected, there's no stigma, and that he feels that he's wanted. Two, it has been shown that this social support actually makes this person come back or become well faster than if he will not have this social support. So the family members should actually be taken through about this condition and should be informed what are some of the areas, what are the things that should be done. If it is medication, the person should be seen that he takes the medication as expected, as advised by the medical fraternity, and the things that this person could do early enough, he's supposed to be engaged in them, so that he gradually gets back into the system. And more so, the things that were the probable causes should be avoided, especially in terms of drug, substance abuse, and if they were conditioned, for example, distress in the place of work or in the family, and these could be avoided, the issue could be resolved, or the people could be talked to, they could be counseled, so that these effects are removed. So that is also very important as part of the therapy, as part of the treatment of this person, so that the causes are actually removed and this person gets back to normality. The importance of person having mental health, as some of the things that we had mentioned, we know that it's very important for a person who is mentally well, he will be able to do his day-to-day activity. Two, this person will be able to cope with the changes, because in our daily living, we know there are many changes, there are many challenges in terms of where we are working, in our families, and in the circumstances that we are doing, and the things that we are doing. And also this person, when he's mentally ill, will be able to cope with adverse effects, with the challenges that he faces. And the other thing is that a person who is mentally ill, will be able to interact, the relationship between him and the other people, especially the family and the community, they will be positive. So this person can actually improve or can add value to the community activities. He can contribute to the community activities. So mental health becomes very important for the person himself, to actually achieve his full potential, especially in his intellectual potential, his emotional potential, where he needs to relate with the people differently. He needs to react positively, even if there are adverse emotions, there are challenges in his interaction during the relationship. So the emotional health of this person becomes stable. Then the correct thinking of this person, looking at what he's facing, the flow of his thought, and also the solutions that he gets in terms of what he's dealing with, it becomes the right sequence, and it is actually being positive and adding a value to him and to the others that are around him. So it becomes very important that mental health is actually maintained, and we know some of the things that we need to do to maintain our health. The first thing is that what we take in terms of nutrition, we know it's very important, and this is even important even as early as during pregnancy. The mother, we know there are substances that when they are taken in nutrition will actually aid in the development of the nervous system, of the brain, and the spinal cord. We know issues like folic acid. If it is absent, we know there is abnormality in the nervous system, in the brain, in the nerves of the person, of the child. Sometimes they do not grow to full potential, and sometimes they grow with abnormality. So the nutrition from pregnancy of the mother actually aids in the brain development and in the long run in the mental health. So once also the person is able to take the food, is supposed to take a full balanced diet. These will help. We know there are things that if they're taken in excess will actually affect the mental health, will affect the brain development, will affect the functioning of the brain, which in the long run will affect the mental health of this person. So nutrition and diet is one of a very important component in terms of maintaining mental health. Physical activities, it has been shown that one who engages in physical activity, there are some hormones, endorphins, that are produced by the body, and these enable the person to have better thinking. It helps this person to be able to cope with normal life. They also help this person actually to enjoy what they're doing. So physical activities is one of the area that is also very important in maintaining a mental health. Then the social interactions, normal social interaction, positive social interaction, positive relationship, these actually also contribute to maintaining mental health. So it is important that a person is engaged in activities that relate to the family, they relate to the bigger society, they relate to the community. So in the long run, that this person is within the normal social activities. We also know that avoidance of substance abuse is very important. There are several drugs, medication that have been associated with mental illness. So to avoid these becomes very important. And somebody should actually have like a small plan in terms of how to maintain your mental health. You look at the little things that you can basically do and which can add up to the bigger thing. We know also that issues of reading, and especially it has been shown things that are associated or related to your belief. So the spiritual aspect, if a person interacts, if a person learns his spiritual aspect, it has been shown that actually the mental health and most of the things perceived in mental health are related to the person's beliefs, to the person's spiritual health. So for a person, for example, who reads, for example, more of the Quran, a person who reads other books, there is the brain development. The brain becomes more active, and it has actually been shown in the long run, a person who interacts or goes using, reads this, his neurons, that is the nerves that are in the brains, they actually expand, they become more like a muscle that has been used. So when this is used, it becomes bigger. So in the long run, when they were supposed to break, because in the long run, the neurons they break, they will start to break later compared to a person who did not used to read, or a person who did not used to use his brain, things that will actually engage his brain. So brain activities are very important in maintaining mental health. And once person feels or thinks does not have mental health or has a mental disorder, it will be important that people are aware some of these signs and symptoms that this a person could be having mental illness or disorder. And the first thing, if possible, for such a person, if he's able, is to speak them out, talk them out, to discuss with a person that either he trusts or knows he'll get help. So one of the areas that people could do this will be the family members. So a person who talks, for example, to his or her spouse, a person who talks to his brothers or sisters, so that he can get some help. This could just be basically initially being able to cope with maybe a distress that has occurred or a situation that is now not normal, or is leading this person to have some anxiety, some depression, so that they can look for a solution. The next step is, if this person cannot get the social help, the immediate support goes to the experts. We know counselors that can help in this. We have psychiatrists that also can help in this. So it is very important that a person identifies them, gets help, and is able actually even to get medical assistance when needs arises. So basically what we are saying, mental health is a very important ingredient in the other aspect of health. One who does not have mental health will be very difficult to cope with day-to-day activities, and will not be able to interact actively, positively with other people, with the society, with the community, and it will be very difficult for this person to cope with the normal changes, with the normal adverse effects in the area. So maintaining it is the best solution. Once we lose or we have mental illness, it's very important to gain it. And all in all, we need also to be able to maintain the other aspect of health, so that our mental health is top-notch. Shukran.
كن سعيدا كن فريدا عش بفخر في الحياة لا تبالي فالمعالي بالتحدي لا سواه كن سعيدا كن فريدا عش بفخر في الحياة لا تبالي فالمعالي بالتحدي لا سواه